You know, I have been working side by side with nurses for 13 years, and I have lived with a nurse for the last 5 years. And during that time, I have found out that there are certain things that get under a nurse's skin. So right now, we're going to talk about the top 5 things that annoy nurses. Number 5. Patient family members who ask a million bazillion questions, always try to cause some kind of controversy and think that they have more medical knowledge than the nurse. Now, I'm not saying that patient family members should not ask questions, because they should have an understanding of what is going on with their family member. But there are certain family members that take that questioning to an extreme, and they tried their best to make the nurse look like they're incompetent by asking questions and saying things like, "Hey, why hadn't Mama had her Januvia yet? Well, it's 8 a.m. She usually gets it by 6:30 a.m. every morning. You're going to have her diabetes all messed up. Hey, what's that you giving my daddy for heartburn? Omeprazole? Well, my daddy takes Prilosec. Well, luckily, Prilosec and omeprazole are the same things, dum-dum." And if you think you have more medical knowledge than the nurses and you could do a better job, then why did you bring them to the hospital? Why didn't you just use your little WebMD expertise and get them better at home? Number 4, patients who abuse the call light. The call light is there for a reason. If a patient is in bed and they cannot get out of bed to use the bathroom, then they should hit the call light. If a patient is having a medical emergency, they should hit the call light. But some patients like to hit that call light like they're a Jeopardy contestant trying to buzz in to answer the questions. The problem with these nurse call light abusers is the fact that they are taking the nurse away from doing their actual job. Every time a nurse has to run and answer a BS call light, it's taking them away from delivering meds and taking care of the patients who are actually sick. So if you're a patient and you needing your pillows fluffed, don't be hitting that call light and asking the nurse to come fluff your pillows. Because last time I checked, it says RN on the badge, not housekeeping. Number 3, the patient treating the nurse like a waiter or a waitress. So, I don't know if you saw all them signs as you was being wheeled down the hallway, or the big humongous signs outside on the building. But this ain't Red Lobster. And the nurses and medical staff are not waiters and waitresses. This is a hospital. And we all know that hospital food ain't the greatest. So asking for a snack here and there is okay. But 4 or 5 times every hour is a little much, because once again, nurses have better things to do than serve you up crackers and juice 5 times an hour. Number 2, patients who are drama queens or kings. For example, the 45-year-old male patient who has 5 tattoos, but yet screams you're killing him before you even stick him with a little 23-gauge needle. Or the patient whose pain is always a 10 out of 10, even though as they're telling you this, they are texting and eating snacks. And earlier, as you were standing outside their door, you could hear them laughing and cutting up. But their pain is always a 10 out of 10. And last but not least, the number 1 thing that annoys nurses is being short-staffed. Because a nurse knows when they walk into the report room and the first words they hear are, "Well, we're going to be a nurse or 2 short tonight," or "We're not going to have any CNAs on the floor tonight," they know that they're going to have to work a lot harder for the next 12 hours. As if working on a fully staffed unit weren't hard enough, now you have more patients, you have more assessments, you have more meds to give, and you have more charting, which means by the end of the shift, those nurses are not going to be happy. Which is why being short-staffed is the number 1 thing that annoys nurses. God bless y'all. I love you.